Today we have Ms. Celia Hodnett, who works over at Thrive Counseling and Psychiatry as a licensed professional counselor. Thank you so much, Celia, for joining me.
Thank you so much for having me. I'm so excited.
Yes, absolutely. And for viewers who are not familiar, I know Celia fairly well. And her husband, and I'm just so thrilled to have you as part of this important series. And I was wondering if you could just let our viewers know, like, how long you've been a counselor and what influenced your choice in becoming a counselor, and do you have an area of specialty?
Yeah, so I became a counselor in August of 2016, and that's when I graduated from UAB with my clinical mental health master's degree. And when you graduate with your master's degree, you are a counselor, but in order to get licensed, you have to get 3,000 supervised hours, and you have to pass an exam. So I did all of that, and it took me a little bit. Some of my hours came from getting my EDS in counseling, and some 2,000 of my hours came from being supervised. And so that is how I became a counselor. So I've been counseling for about, I don't know, 5 years, I guess, since it's 2021, maybe. Yeah. So I'm
Like, what
terrible
is
at math.
time?
Yes. And I have worked with people of all ages. I mean, I'm talking 5 years old to 85 years old. And I've worked in schools and I've worked in community counseling clinics. And my specialties, I would say, are mostly anxiety and depression. But as I'm getting more into my career and learning more, there's more things that I realize, okay, I'm good at dealing with that. And honestly, anybody who walks in my door is welcome. Whatever they're struggling with, I will research it and try to be the best counselor for them. So my specialties, yes, they're there, but I like to help anybody.
And would you say that, like, I guess your passion for helping others, like, influenced your career choice?
Yes. So I actually started my bachelor's degree and I was going to go for nursing, but I started working as a patient care technician and realized, no, I want to help people, but I don't want to do this aspect of helping people. So I actually got to go on a trip to Italy to learn about the counseling profession in Italy and realized, okay, this is what I want to do. And so I switched my major to psychology, and then it went from there.
What do you feel is the importance of mental health and, spreading awareness about a healthy, mental well-being?
Yeah, I believe that mental health has is not always treated exactly like physical health, and I believe most people know that, because when you're out in public and somebody says, "Oh, I have the flu," you try to help them, but sometimes when somebody says, "Oh, I'm feeling a little bit down today. I'm feeling a little bit depressed," some people might say, "Oh, you'll get over it. It's going to be fine," and that's not the case. So I just think that mental health is so important to destigmatize. It was stigmatized for a while. I mean, hysteria used to
Absolutely.
be a thing, and
Hmm.
so breaking down those stigmas is so important to promote mental health. And just for people, I feel like it's becoming more prominent in society to say, yeah, I'm going to see a counselor. But I actually read a study the other day that said people would rather call out of work for having drank too much alcohol and had to go to the hospital for alcohol poisoning than saying, hey, I'm feeling depressed today. I don't want to go to work. So that was kind of shocking to me. I want to break down that stigma and make sure people understand mental health is so important. It's just as important as physical health.
What would you say, like, especially now, at the hopefully end of COVID, but still in it. Do you have advice for others on making time for themselves, especially, for our adult viewers who are watching and
Yeah,
may have families?
absolutely. I'm a big advocate. If you have time off, if you have your PTO, use it and don't feel
Mhm.
ashamed to use it. A lot of employers will make you feel ashamed to use it, but if you need a day for yourself, take it. And I know when you Google self-care, all you see is look at these press on nails, and there's my cat. And
another form of self-care.
yes, hang out with your animals. But that is part of it. That is, if you get your nails done, that's great self-care. But sometimes it's just making your bed in the morning. Sometimes it's just having a cup of tea. Or I always like to tell people, self-care is not always fun, and it's not always like what you want to do, but to get out and try to do it brings so much more, I don't know, energy. And I'm a big advocate for self-care in any sense of whatever it is. And I'm rambling now, so
oh no, it makes, and and I kind of learned something from that just now, because I think of self-care as like, treat yourself, like Parks and Rec, for anybody who's familiar, Aziz and Sorry, treat yourself. But it's interesting that you say that it's not always going to be something that you enjoy. It's sometimes things that you should do for yourself that'll benefit you, even if it's not so fun.
Right.
Which
absolutely.
I think that's so, you're absolutely right. And I hadn't thought of that. And that's why I love doing these, because then I get to
you learn.
How did your occupation change during the last year? And if at all, and what kind of things did you learn from that experience?
Yeah. We immediately transitioned to telemental health, and that was kind of difficult because last year at this time I was working in a rural community, a private practice, and it was all the way out in Sneed, Alabama. And a lot of the clients out there did not have internet connection. So it would be telephone calls, and it's hard when you're a counselor to not see body language. So that was definitely something I've had to navigate, is trying to decipher people's actual feelings and thoughts from how they say things, because now I can't see them looking down when they say, oh, everything's good. I actually have to hear it, and I feel like it's made me a better counselor in a way, so I'm kind of thankful for it. I also am about to transition from being a career counselor at Jefferson County Schools, which I do full-time at the moment, and I work part-time at Thrive, but I'm about to transition fully into Thrive. And as a career counselor, schools were shut down, so I was just online trying to make videos for students and people who needed to know how to apply for college and get into that aspect of the world that they were about to get into, the seniors from last year. So it was different, but it helped me a lot in my career, because I also started a PhD program, which probably wouldn't have done unless that had happened.
Awesome.
Yeah.
That's incredible. No big deal.
I'm excited. No big deal.
Just getting my PhD, doing big things. That's awesome.
Yeah, I started at Walden, but I'm transferring to University of Alabama, because I want the connection with the classmates and everything. And Walden's all online, so I'm excited.
You are a big supporter of community. It's, kind of aligned in, like, I guess, in a lifestyle, in the way that you live in Birmingham. And so how does your occupation align with supporting community?
I think, like I said before, it helps a lot of people in the community get access to mental health, because yes, we take insurance, but we also take private pay clients, and we talk with the clients about what can you afford. And I'm all about counseling being a right and not a privilege, because it is looked at as a privilege, and it shouldn't be. Everybody should have access to counseling. And we have offices in Trussville, Hoover. They just put one in Gulf Shores. We have one in the center of Birmingham. So not only are we working with Birmingham, but also the outside communities outside of Birmingham, and helping them get the mental care that they need. And they just put a psychiatrist on the staff. So that's so important too, because a lot of people are scared about taking medications, which is understandable, but sometimes a mixture of therapy and medication is the perfect combo. So sometimes therapy's good, but that is how I think we help the community. And I just like knowing that I'm helping people be the best version of themselves that they can be.
What are the things in life that bring you joy, and how are you making time for them? I saw that you went to Disney World. I'm very jealous.
Yes. Disney World is probably our favorite place on the planet because we don't have children, but we go and we can just feel like kids and do it, be in Star Wars land or Toy Story land and feel like we're somewhere else, and it's just a great escape. So I love making time to do that. We do plan on going to other places that we haven't been, because there's a lot of places in America that I haven't seen that I would love to see, and a lot of places outside of America that I would love to see. But my animals bring me so much joy, and I love being with them. They are my favorite things in the world. We have 3 dogs, a cat, and a turtle. So lots to take care of. And yeah, I like doing that. And I listen to a lot of BTS. So I've been trying to learn Korean, which brings me joy.
So you love K-pop. That's amazing.
Yes, I do.
Yeah, I love the first. So for viewers who don't know, I'm Korean, and so like I kind of grew up with like Korean pop just from commercials, my mom's television. Yeah. But I love seeing people's reactions when they first see it, because it's so happy, and they're just like, "What is this?"
You can't be sad.
You can't. You can't. Your favorite books or films, and what are you watching or reading lately?
Yeah, so I'm a part of a book club with some of my friends. So
nice.
we try to read a book every month. During COVID, it got kind of iffy, but it's still going. And I recently read a book that I really loved, and it was called The Heart's Invisible Furies. I cannot think of who wrote it. I can't think of who wrote it. And it was just so charming. I just loved it so much. And last year, when the Black Lives Matter movement was happening, I tried to read a bunch of books like How to Be an Anti-Racist by Ibram X. Kendi. And I really liked that because there's a lot of things I didn't know. And just trying to educate myself so I wouldn't have to have, for example, my clients educate me. And even with my clients, like knowing from that book to say, okay, how do you feel about George Floyd's death when it happened with my Black clients, and asking them, what are your thoughts and feelings about that, and giving them that space to open up about it and have a safe space to talk about it. And I love the movie Tree of Life. Terrence Malick directed it. It's the cinematography is beautiful, but every time I think about that movie, I think about how small we are as humans and how the universe is so big, but as humans, our problems and our issues and our lives are so big within the universe. And I don't know, it's just a very thought-provoking movie. And I know you didn't ask about TV shows, but
oh no, please, yeah.
I think a lot of therapists or counselors will say this: The Sopranos has the best representation of therapy that you can find. And I just love seeing how Tony Soprano is doing all of these things that are bizarre and horrible, but he comes into therapy and he'll just be like, she ate my cheese. Like, why? Like, why would she do that? It's a fact that happens, and you just have to figure out, okay, it's not about the cheese. What thought is he having right now? But we were watching Curb Your Enthusiasm last night, and it was a episode about therapy, and the therapist gave Larry the worst advice ever. And I looked at my husband and said, that is why counselors never give advice. A lot of people will come in and say, okay, I need your advice. And I always stop them and say, that is not what I do. I help you find what's best for you. I'm never going to give you advice. I might give you suggestions, but I'm going to tell you this is what you need to do. So I don't know. It was just funny to see. I was thinking about The Sopranos and how great it was, and how in Curb Your Enthusiasm it was just awful.
Larry David is pretty much the best. Like, Curb Your Enthusiasm, by far one of the best TV shows ever. And, you know, my
It's
partner will say
hilarious.
that both that and The Sopranos, like, made me watch the entire thing from beginning to end, The Sopranos, like, during COVID, as well as The Wire, which I loved.
I love The Wire.
The Wire
Ooh,
was great
so
to
good.
see little Michael B. Jordan. I was like, oh my God, look at him.
Yes. We had a dog named Omar after Omar from The Wire.
Stop! Stop! That is amazing. Omar is my favorite character. And
Same.
I don't know if you watch Lovecraft Country, but he's
I
in
love Lovecraft. Yes.
And I was like, oh my God, it's Omar.
He's so good in it. He's kind of
so
mean,
good.
but he's so good.
I love that. I just feel like I just became closer to you.
Yes,
I was
definitely.
wondering if you had advice for viewers who might be watching who may personally be struggling with their own mental health or know a loved one that is, and if you had some advice for them on how to seek help, like maybe small steps, and possibly like recognizing triggers, or even practicing small mental exercises of ways to cope.
Yeah, I think a lot of people are scared to ask for help because it may feel weak or like nobody will understand them. And I would venture to say that asking for help is one of the strongest things you can do, because it says, hey, I can't handle this on my own, and I need somebody else to walk me through this. And there's no shame in that. And just to pick up the phone and call, or just browse through places like Psychology Today and find a counselor who's affirming of whoever you are. All counselors should be, but I've heard of horror experiences with counseling, like a counselor falling asleep on a client or saying something rude. And I'm a big advocate for counseling being like, I hate to use this term, but dating, because
it is. I was about to say, it's like dating.
It is, because once you go into a counselor and you don't like them, it's okay. You can find another counselor. I tell my clients that first off. I say, you're not here for me. I'm here for you. But if this isn't working, I'm not going to be mad, because this is your time and I want you to get the best out of this that you could possibly get out of it. So I check in with them all the time and say, okay, what's working? What's not working? And a lot of counselors are out there, they might be a little bit burnt out because they aren't getting enough self-care, and it puts a bad light on counseling. So finding a counselor that's right for you can be a process, but it's worth it. And you asked about little things people can do. I think self-care, and again, it's not all about physical, it's about your psychological self-care, your emotional self-care, your spiritual self-care, like meditating. Some people don't like meditating, that's okay. Maybe yoga, maybe just being with nature, that is self-care in itself. And even professional self-care, when you can extend your career or find a career that you're happy with, because as a career counselor, I think that it is so important to find a career you love, because you're going to be there, unfortunately, most of the day. But it's not unfortunate if you love your career. So it's so important to find that career you love. And just deep breathing exercises. There's this one thing. If you close your nostril and breathe in through that nostril, close the nostril that you just breathed in and breathe out, it regulates your mind and your body. And it works for some people, maybe not for all, but that's a good one that you can kind of take with you and know, okay, I have that resource right there.
Yeah, I think the breathing for me definitely helps. Like, I'll catch myself and be like, oh, I just need to breathe, and then I don't think as humans we breathe like how we're supposed to, especially as we get older,
Definitely.
And becoming an adult with all the stress, you're like, oh, I gotta remember to breathe.
My Apple Watch oftentimes will say, it's time to breathe. And I realize, I think I've been holding my breath for like 30 seconds.
Well, Celia, thank you so much for joining me today. It's been an absolute pleasure. And I'm just so happy that you graciously accepted to be part of this special series. And I'm wondering, is there a way that viewers can follow you on social media? Do you have any self-care things going on?
Yeah, I have a Twitter and it's at CC Hodnett. And I talk about a lot of different things on there, different self-care tips, different counseling tips, things that I think people might need to know about their mental health. And we have Thrive has a website. It's thrivetrauma.com. And if you're looking for a therapist, we have a ton of therapists there who would be great. And you can see who you might job with. And we're all very nice and professional. So thank you so much for having me.
Of course. And I hope that you have a wonderful week, and hopefully I'll see you sometime soon.
Sounds good.
All right. Bye.
Bye.